Remember, the stories and plight of treating this disease are just as important now, even after fading from the top of the conversation. In fact, interesting to note here, November is when doctors see a rise in women getting mammograms scheduled after raised awareness during the month of October for Breast Cancer Awareness Month. Every year in North Carolina, more than 5,500 women continue to be diagnosed with invasive breast cancer. Although this number remains high, the good news here is advances in research are leading to improvements in both incidence rates and long-term survival. In fact, nearly 90% of women now live 5 or more years after diagnosis, and 80% live 10 or more. One woman who looks to be part of that improving statistic is Afi Hunsucker. She lives in Charlotte, working as a software product manager. She's married with 2 young daughters.
Just the regular chaos. Husband and I keep busy with our jobs and maintaining a home and making sure at the same time our kids are taken care of and meet their needs. Just, you know, pretty normal.
Yeah, we can all relate, right? As a young mother, Afi admitted she was more worried about her daughter's health than her own. Too busy to be sick, she said. But Afi's life took a dramatic turn when she learned she was diagnosed with breast cancer at just 34 years old. A fortunate find, really, in some way, considering the American Cancer Society recommends women start getting mammograms at around age 40. Also, there's no guarantee insurance will cover mammograms for women with no family history still in their 20s and 30s. So for young women, these potentially life-saving screenings just aren't yet on the radar. But it was a reality Afi was now forced to face. How does that hit you when they first call you and say, it is cancer?
I actually just recently wrote about that. I wish I could hold myself then and tell her it was going to be okay. Again, there was that hollowness within me. There was just sound, echo, and movement around me that I had no control over. There were things happening to me without my willingness, without my... I didn't permit for this to happen. I didn't want this to happen. And it was happening anyways. And to come to terms with it, I don't even know how long it took to come to terms with it. I think it was a while before I was like, okay, well, this is it. Now what?
I imagine you're thinking too, you're the one going through this battle, this journey that's about to start with cancer, but you've got young kids. Am I going to be here for them? You know, all of those things. Were you dealing with those emotions?
Yeah. So, not that it's ever a good time to hear those words, sure, or to even get the diagnosis ever. But coincidentally, it happened that it's near the holidays, and the holidays themselves are just emotional time of the year. I remember writing letters to my daughters, not knowing what my diagnosis means. I don't know if the letters were so much also for them or for me, you know, in a selfish way, wanting to still be close to them and be able to tell them what I want to tell them for the rest of my life. But in case, you know, that's cut short.
But Afi wouldn't have her life cut short without fighting. Her cancer diagnosis led her to make a difficult decision, undergoing a bilateral double mastectomy. It's an emotionally taxing procedure where many women wonder what their physical and mental state will be post-operation. But having lost her own father to cancer, Afi knew it was a necessary step to ensure as much time with her family as possible. After the procedure, she sought the help of reconstructive surgeon Dr. Ashley Chandler, who specializes in breast augmentation, to rebuild her body in this new chapter of her life. We spoke with both women on what life is like after a life-altering operation and what is still left behind. You had options, right?
I had options.
Why did you choose the one you chose?
Why did I choose the one I chose? Let's go back a few questions. The 2 little girls that I want to see grow, that I want to give my 100% of my attention to. I'm a mother, I love them, and that's what I want. And the option that I chose, though aggressive, It was the best option for me.
There's the physical side of this, but that sounds to me like a massive
it's
psychological.
Way mental.
Yeah.
So we know statistically women who wake up with a breast reconstruction at the time of mastectomy do better. Even in their fight against cancer, their mental outlook, and even some of the like recurrence kind of rates and things like that. We just do better when we're mentally healthy and when we look how we feel like we should look.
It wasn't a debate, really. I mean, because there are obviously, right, other issues that go along with that, right? It is, it's life-altering, it's body-altering, right?
It is. It is. I mean, this is going to sound a little aggressive, but yeah, you're basically opting in to butcher your body, to give up a part of you. And you know, it's been so good to me. I'm confident in my body, and and all of that. But I had no choice. I had choices. I did have choices. I don't want to say that, but in that moment, the choice that I made to do the double mastectomy was so hard. It was the best decision for me in my situation. For you to provide that normalcy, what does that mean to you?
Oh, I love it. It's exactly why I went into plastic surgery. I knew I wanted to be a surgeon. I thought I was going to be an orthopedist because that's what my dad was. And then when I was in medical school, I love working with women in OBGYN and surgery. And then I just met breast cancer patients and I was like, this is it. I love it. I work with women. I get to do the positive part, right? It's hard, if every now and then in breast surgery we find someone that has breast cancer. I'm glad I don't have to deliver that news every day. Yeah. It's rough. So I just get to do the part that makes you feel good.
Here we are in November. We're coming up on the holidays again. Yeah. How does this holiday going to compare to what you went through last year? I mean, there's still tears, but different. They taste different. They feel different. I was just saying that it's our anniversary with Dr. Chandler. I met her sometime last year around this time, but completely different predicament. Completely different sensation. It wasn't as bright in here, though it was. It's same office, same lights, same staff. The darkness is gone. That cloud hovering over is gone. And I'm just grateful. Appreciate the candid conversation. It's now been a year since Afi's operation. She and Dr. Chandler want women to know and feel at ease if they're considering reconstructive surgery.
People just need to know, A, it's covered by insurance forever. And women that don't have insurance, there's a ton of programs out there with the hospitals. So don't feel like I don't have insurance. That's it, I can't do this. Yeah. It's not true. There's tons of programs out there. And I also tell people, just don't be ashamed of it. Like, you have lost a body part. Yeah. You have the right to have it restored and feel whole again.